So we use prolotherapy and PRP to treat cervicocranial syndrome because we can actually address the root cause of the problem. And the root cause of the problem is damage in the joints. And often this damage is not seen on MRI. We may see signs of it to where we see a straightening of the spinal cord, or you might see abnormal pressures in certain areas, but often the areas need to be palpated by a physician who's very skilled in understanding the cervicocranial junction. And we treat these areas using regenerative medicine like prolotherapy, PRP, and stem cell procedures because both are extremely safe if done with experienced hands, and also they're extremely effective in rebuilding the joint damage that leads to the cervicocranial syndrome. So if you can figure out what the problem is and reverse it, then you can actually help to heal the patient and end their symptoms. Furthermore, it's really important to take a holistic view of the patient, what I call the Greenberg method. In the Greenberg method, not only will I look at the cervicocranial junction, but I check the alignment of every vertebrae, see how the head is positioned on the skull. You need to check other areas like the jaw and the temporalis and see if there's abnormal tension, because the fascial areas all connect. And really importantly, we always see patients who have dysfunction in their scapula. And usually their chest is pulling too much, it pulls their shoulder blade down, the pulling on the shoulder blade tugs on the neck, the tugging on their neck pulls on the cervicocranial junction. So I think you understand what I'm getting at, is that it's a whole chain effect, and we want to unravel the entire chain, not just treat where the symptoms seem to be or where the damage seems to be, because if you're missing these other areas, then you're really missing the boat in creating the best cure for the patient.